Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. SCAD. Introduction. SCAD stands for short-chain acyl-coenzyme A dehydrogenase. SCAD is also known as SCAD-D, SCAD deficiency, and SCAD-H deficiency. SCAD is a rare inherited disease. It can cause developmental problems and death if not treated, but the majority of patients will probably never have problems. SCAD is rare. It is estimated that about 1 out of every 40,000 to 100,000 babies in the United States is born with it. Babies can be checked for SCAD with a blood test right after they are born. SCAD patients can have problems with learning, seizures, or low blood sugar, but the majority will never have problems. This health education tutorial explains what SCAD is. It discusses its causes, symptoms, diagnosis, and treatment. What is SCAD? SCAD is caused by the lack of a substance required to convert fat to energy. This section explains the biology of this genetic disease. The human body uses the food we eat to produce the energy needed to function. When the food we eat is more than the body needs, the body stores the excess food as fat. Later, when the body needs more energy, it starts converting the stored fat to make energy. Substances called enzymes do the conversion of stored fat into energy. One such enzyme is called short-chain acyl-CoA dehydrogenase. It specializes in breaking down a certain group of fats known as short-chain fatty acids. This enzyme is defective in people with SCAD. When people with SCAD fast or do not eat for a relatively long period of time, the body tries but fails to break down these short-chain fatty acids, which can result in low blood sugar, low energy, liver or muscle injury, or coma with possible permanent brain damage. This is known as a metabolic crisis. When people with SCAD are sick, such as when they have the flu or cold, they eat less and they are more likely to have a metabolic crisis. Patients with SCAD could die during the first episode. The majority of patients with SCAD will never have problems and can fast without any difficulty. However, doctors cannot say which baby will have problems and which ones won't by a simple blood test or by looking at the patient. Because of this uncertainty, some doctors treat all babies with SCAD like they are at risk of having problems in order to prevent anyone from going into metabolic crisis. Symptoms. Most infants do not have apparent symptoms at birth, but symptoms may appear in the first couple of months of life and include low muscle tone and not developing normally. For others, symptoms may appear the first time they fast or don't eat well. This may happen days or weeks after birth and include lack of weight gain, general failure to thrive, vomiting, and poor eating. Illnesses such as cold or ear infections can cause the child to not eat well. This prolonged fasting can lead to coma, heart arrest, and sudden unexplained death. However, the majority of patients will never have any problems at all. In addition, if you know the child has SCAD, the possible complications can be prevented. People with SCAD that have symptoms can have brain damage from their low blood sugar, which result in significant developmental disability, muscle weakness, and failure to grow and develop normally. If SCAD is diagnosed, it can be treated with a special diet, avoidance of fasting, and prompt medical care during illness. The person will have a normal life expectancy. Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials. Causes. SCAD is inherited, which means children get the gene for it from their parents. This section explains the genetic basis of SCAD. Genes tell the body to make certain substances. Every person has thousands of genes. Our genes make us look the way we do. They also have a lot to do with our health. Each person has 23 pairs of chromosomes. Genes are found on the chromosomes. The gene for SCAD is on chromosome 12. This gene is responsible for making the enzyme short-chain Acyl-CoA dehydrogenase, which breaks down short-chain fatty acids. The SCAD gene either works correctly or it is defective. We will call the good SCAD gene that works correctly N for normal. We will call the defective gene that does not work correctly D for defective. Everybody has 2 SCAD genes, one from their father plus one from their mother. If both SCAD genes are defective D genes, the person has SCAD deficiency. The good N gene is stronger than the defective D gene. Therefore, if a person has at least one N gene, he or she does not have SCAD. An NN person does not have SCAD at all. An ND person does not have SCAD but carries the defective D gene. This is a SCAD carrier. A DD person has SCAD. When a couple has a baby, each parent gives one of their SCAD genes. Which of the 2 genes the baby gets from each parent is random. If both parents are NN, their child will not have SCAD. Each parent can only give one N gene. If both parents are DD, which is a rare occurrence, their child will definitely have SCAD. Each parent can only give a D gene. If one parent is NN and the other is ND, their child has a 50% chance of being an ND. Since an ND is only a carrier, they will never have a child that has SCAD. The NN parent will always give a good N gene. If both parents are ND, their child has a 1 in 4 chance of having SCAD. In 2 out of the remaining 3 chances, the child will be a carrier. It is important to remember that each time this couple has a baby, there is the same chance of the baby having SCAD. If a couple's first baby has a 25% chance, or 1 in 4, of having SCAD, any other babies they have will have the same chance. SCAD Test. Many states and territories test babies for SCAD as part of the routine newborn screening blood test before they leave the hospital. This can be done by testing the blood for certain compounds. A nurse pricks the baby's heel and gets a few drops of blood. The blood is tested for SCAD as well as other metabolic diseases. If you live in a state that does not perform SCAD or expanded newborn screening on its newborns, or if your child was not born at a hospital, there are laboratories that can perform the screening for you. Treatment. Treatment for SCAD is simple and effective. It consists of avoiding fasting for more than 4 hours for infants. Older patients should avoid fasting for more than 12 hours. Your healthcare provider may recommend a low-fat diet. During times of illness, when a person with SCAD cannot tolerate food, it is important to give fluids that contain sugar. This may require treatment with intravenous fluids in a hospital. Supplemental carnitine may also be recommended. Ask your healthcare provider for more details. Some healthcare providers recommend riboflavin or vitamin B2 supplements, which are taken orally. Ask your doctor if he or she recommends riboflavin or other supplements for you or your child. If you like this video, please like and share. For similar videos, subscribe to our channel. Summary. SCAD is a rare inherited disease. It can cause developmental problems and death if not treated, but the majority of patients will probably never have problems. SCAD is inherited, which means children get the gene for it from their parents. Many states and territories test babies for SCAD as part of the routine newborn screening blood test before they leave the hospital. A nurse pricks the baby's heel and gets a few drops of blood. Treatment consists of avoiding fasting and providing glucose in the form of juice or other sugar-containing fluids during times of illness. Parents of children with SCAD and adults with SCAD should discuss diet and treatment questions with a doctor. Thank you for using Explain.